So I chose to study medicine purely based on a positive experience I had when I had my Year 10 work experience. And at the time, in Year 10, I knew I wanted to do something in science, and I wanted to do something with people, because I quite enjoy working in a team. And I decided to do my work experience at Walker-based hospital. And at the time, I was more looking at the science side of things, but purely by accident I was assigned to one of the medical teams at the hospital, so I got to follow around the medical intern and medical registrar for a couple of weeks, and I was totally amazed by the work that they did, the way they interacted with other people, with the staff, the way they worked as a team, the constant problem solving that was part of their career, and that's what sort of motivated me to get into medicine and to study medicine as a career. So I decided to do 3 years of my clinical training at Walker Rural Clinical School. At the time, it was a big decision for me, because the Walker Rural Clinical School had only just started, so there wasn't much experience amongst the medical students about what sort of training we would receive. But the fact is that led me to undertake 3 years of my training there was the fact that firstly it was rural, and I'd always wanted to work rurally in the future, and having a rural background, I was very comfortable in that environment. Secondly, I knew a lot of the doctors in Wagga anyway, so I already had some connections there. But I think the main driving force was that it was a small cohort of students. At the time, we started there with 8 students, so it was a very small group. We essentially had one-on-one teaching. It was very hands-on, and again, because at the time there hadn't been many medical students at Walker-based hospital, the consultants and registrars were always looking for students to help them out. And I certainly had a lot of interest in surgery at the time, and I remember spending a lot of time in theatre scrubbed assisting at a lot of the operations. And I think that's an experience that you get rurally that you probably would miss out on in a big metropolitan hospital, where you have to line up behind all the other medical students and trainees. There are many advantages to studying at a rural clinical school. From my experience, what I found was having a small number of students there. I had a lot of opportunity to learn directly from consultants and senior doctors. Having pretty much a one-on-one teaching allowed me a lot of opportunity to actually do things. I learned a lot of procedural skills as a student that maybe in metropolitan hospitals you wouldn't learn until you're a resident or even junior registrar. Being at a rural clinical school offers you a very general training across all the disciplines. Again, in rural areas we tend to be less subspecialised and very much more generalist focused, so it's easy to get a good understanding across the spectrum of medicine. The rural clinical school is also able to offer a lot of non-traditional experiences in medicine, so a lot of community health experience, a lot of general practice experience in different locations. So, for example, I was at Walker-based hospital, which is a major regional centre, but from there I was able to go out to Miranda, which is a district hospital, so a smaller rural facility, and out even to smaller rural and isolated towns to do outreach services. And they're experiences that you don't get in a metropolitan area. And the advantages of being a student is you actually are given a bit of responsibility on these placements, because you're there and you need to help the healthcare providers in caring for the community. So it's a very active role. As a student, you're not only there to learn, you're actually there to also help and contribute in the healthcare of the people that you're seeing. And as a student, that's a very rewarding experience. After studying at the Wagga Rural Clinical School for 3 years, I had certainly decided to continue my career in rural health, and there's a number of factors that influenced that decision. One of the big factors was having experienced what rural health care is like. I saw how closely the teams work, so how closely the doctors work together, the nursing staff and the doctors and allied health. It was really a very team environment, and that certainly made your life easier on a day-to-day basis, but also made it more enjoyable. it was very easy to get consults and advice from other specialties and senior consultants. I never felt alone or isolated in a rural area. There's always a strong sense of team and camaraderie, and as a junior doctor, that's very important in your career, because you need to feel comfortable and supported as you learn to become a senior and experienced doctor. The other thing about living in a rural area is the lifestyle itself. The rural lifestyle is very relaxed. It's very comfortable. I don't have to worry about things like parking. I don't have to worry about traffic congestion. For me to get from work to home was 5 minutes in the car, and I could just park at the front of the hospital every day. I had my own car park and would be there on time. Everything was is so much more relaxed. People are friendlier, and I think people in general in rural areas do understand that healthcare is sometimes a bit disadvantaged in rural areas, and they're very appreciative of the care that you do provide. And going home at the end of the day after feeling that you've contributed positively to a lot of people makes your day a lot more bearable and a lot more enjoyable, and it encourages you along your career. Here at Griffith, we believe in building multidisciplinary healthcare teams. Health is in the middle of rapid change, and teamwork is becoming a really important and critical part of the function of healthcare. And here at Griffith, we do believe in developing teams amongst medical providers, but also the teams between medical providers, nurses, allied health, patients and the family, and community. So a lot of our training is multidisciplinary. A lot of the training we provide our students is combined with junior medical officers, is combined training with senior doctors, is combined with with nursing students and nurses. So by doing that, we're all able to develop a deeper understanding of each other's roles and what we can contribute to overall patient care. Here at the Griffith Rural Clinical School, we like to offer other opportunities that you wouldn't experience in a metropolitan hospital. And some of the things that we've done with our students has been Farm Safety Day. And the main focus of this day is looking at farm safety and a lot of the injuries and traumas that we see from farmers. And agriculture being one of the main industries in Australia, we certainly see a lot of injuries and harm coming out of the farming sector. So what we've done with our students is we've gone off to a small district facility, and we've spent a day working with the nurses and the doctors from that facility, working with the ambulance officers, and looking at some of the issues that we see coming from farmers, and in particular some of the traumas that we do see coming into the emergency departments. And during this day we used a lot of simulation, and we used a lot of actual real life cases and scenarios that a lot of the ambulance officers from these areas were able to share with us. We've spent a lot of time talking about interesting things like snake envenomations, spider bites, and those sort of things that you might not necessarily see in city areas. We've spent a lot of time with the students actually on farms and looking at some of the equipment that they use, what is it like to be a farmer and their everyday experience, a lot of the risks that are involved in their career, and maybe some of the underlying factors as to why some of these farmers and rural people are sometimes very reluctant and slow to seek medical help. And generally, once you're on some of these properties, you realise the isolation that these people experience and some of the challenges that is part of their career.